listening to Rated RX. Your dose for the day.
All right, everyone, welcome in. Thanks for tuning in to a special episode of the Rated RX podcast, a proud affiliate of the Pharmacy Podcast Network. Let me start by saying, yes, there is something weird with my voice. A little background for you guys. I have a procedure called a SARPI coming Monday, and this procedure consists of them splitting my jaw open and slowly stretching my mouth out over time, which is really interesting because it's an outpatient procedure, but still requires an anesthesiologist. And I so happen to have one with me today, Dr. Zack Meade. Now, I'm going to start by saying, with this expander in my mouth, a little challenging to say, I'm just going to call you Dr. Zack for the interview. Dr. Zack, is that okay with you? May I call you Dr. Zack?
Please do. Please do.
Thank you very much. So, Dr. Zack, your wife was actually on our show a while back, and she was actually our first guest we ever had on the Radar X podcast.
Wow.
Do you remember? Do you remember your wife's name?
I do. Hey, I do remember her name.
That's
sometimes.
good.
I was just curious though. So this is a surgery you're getting to make your mouth larger. My wife says I have a large enough mouth. Is there one to go the other way?
Hey, there might be, and maybe she'd be willing to put the money up for that if it really helps her the most.
Yeah.
Well, Zack, thank you so much for being with me today and joining me for the show. Listeners, for those who don't know, Zack is a big social media influencer, putting out information online, a lot of times correcting misinformation, giving a lot of patient education advice. Zack is no ordinary influencer here. He's quite the popular man. He has 123,000 followers on Facebook and 54,000 on TikTok. So not just a typical guy, very, very famous. So that brings me to the first question with you, Dr. Zack. What made you get online? I mean, this kind of growth just doesn't happen overnight. And obviously you have some sort of motivation that keeps you going. So why did you decide, hey, I want to get on social media, and why did you decide to stay online?
So it was like November of last year, actually, about a year ago, I started posting on social media. I was actually really anti-social media before then. I had a Facebook, and I just had it to keep up with friends and family. I rarely posted on it. But my wife had been posting since COVID, and she was just having fun with it. And she was like, you should just start posting things. It would be fun. I'm like, okay, why not? So I started posting for fun. And then I had a friend too, whose spouse was a social media influencer. And they kind of told me about some of the numbers they were getting paid. And I was like, oh my God, that's a lot of money. And the numbers they were talking were like physician salary numbers. I'm like,
oh, wow.
You got to have like millions of followers to like make that much money, right? So I check out their profile. They had like 150, 170,000 followers. And I was like, that's a lot, but that's not unattainable, right? So then I kind of kept going to help make it part of my professional portfolio. And along the way, some of the motivating factors, like truly it's a way to help patients and people that you otherwise wouldn't be able to help, right? And it's such a benefit to these people online because they can ask me a really simple question, and I'm not giving medical advice, but simple education or pointing them in the right way. And it's a lot better than having to pay a $50 deductible to their doctor just to ask a simple question, right?
Definitely. So your friends motivated you. Well, it started like your wife first motivated you. And I'll say that she actually motivated me too. I remember that year ago, I remember talking to you two.
Yeah,
and
we invited you guys over.
Yes. And I was like, hey, I want to start a podcast. And you guys said, you should get on social media. And I had the same reservation as you. And I still do, to be completely frank, because there are just certain parts of my life I don't like to show off. And you know what I mean? Especially with the kids around and AI, it kind of scares me a little bit. So you just kind of have to be careful. And it's also just very personal, letting people see like those inner parts of your life that close family loved ones see. So hats off to you. You are killing it with that regard. I'm still very hesitant, but if you have any tips for people like me who want to still be shy, but put themselves out there, hey, I'm always listening. So, but I'm glad you're in it for the right motivation, helping people, saving them some money, and hopefully you spread out your name in the meantime. Something bigger there.
Well, when I first started, I was super embarrassed to post these TikTok videos and stuff. And if you go back, don't go back. Don't do this. Okay. Definitely do not go back and look at my first videos I posted. But they are super cringy. It's like I'm just like sitting in front of the screen, like nodding my head to like a medical drama. And I'm like, yeah, I didn't want to speak. I didn't want to hear my own voice.
I especially don't want to hear my own voice right now, so I can completely relate and I understand. So then what helped you evolve from your first video to now? Like, how did you make this progression, and why are you more proud of your current content than the ones before?
Well, I started consuming more content at this point because previously I wasn't consuming a lot of social media content, and I found a lot of people that I look up to on social media, people that were putting out really good content, really educational, very helpful. And I got advice from them, and I saw what they were doing, and I imitated that, right? Imitation is the highest form of flattery. Isn't that right? Is that
That's
what
what
they
they
say?
say. That's what they say.
But it all came down to I started making content that offered value to other people, not to sell or not that I thought I would like. So I tried to start making content just that I thought people would find value from. And here recently, a lot of that content has just been slapstick humor, medical humor, with some
Love that
education
stuff.
sprinkled in.
Yeah. So you're out there trying to put information online, educating patients, but obviously sometimes videos don't go the way they're planned, and people sometimes get mad. I've been in that situation myself. But has there ever been a time where you posted something and it didn't go the way you expected? People got mad, triggered, anything like that you want to share? You feel comfortable sharing online?
Yeah, there were several ground rules. I had a colleague who um had a collaborative social media account that I think they have several 100,000, probably nearly a
Oh,
million followers. And he kind of told me some tips to follow because they had gotten in trouble in medical school when they were posting. And essentially, it kind of came down to never punch down. Okay. Always punch up, maybe lateral, but always up, right? When you're making jokes. So, if you're a medical student, don't make fun of pre-meds. If you're a resident, don't make fun of med students. If you're a physician, don't make fun of residents, right? But
it's a good rule of
obviously,
thumb.
yeah. And that's kept me out a lot of trouble. And then another rule was never make fun of patients, period. Never make
Mm.
fun of the patient experience. And I see that of a lot of healthcare providers, I think there are some groups that do it more than others, but they're making memes and stuff that kind of mock the patient experience.
Mm-hmm.
And we kind of lose sight that every day at work is normal for us, but for the patient, it's like not normal, right? So, um, however, even with all those rules in place, I have gotten in trouble. I have gotten I've gotten spoken to by my boss multiple occasions,
Wow, it's gone up
but
that high. What was the video that
yeah.
made your boss want to talk to you?
Well, there was a few, but in general, sometimes it came down to like a logo, right? So I was
Oh,
rotating at a
sure.
hospital, and it was never actually the content of the video. It was just like, oh, there's a X hospital logo in it. Can you please remove it because we don't want to be associated with you? They didn't say it like that, but it's
Very
kind of their
reasonable
social media
request, I
policy.
think. Very
Yeah.
reasonable. Yeah.
I did one kind of like case report that was, and we all, if you know anything about medical literature and stuff, case reports, you don't need, if you're not exposing any identifying information, you don't need patient permission to discuss an interesting case. It's standard. It's all standard thing. But anyway, so I made a TikTok like, wow, I had this crazy case, the X, Y, and Z happened, blah, blah, blah. And the patient didn't pass away, but it wasn't the best outcome. And someone at the hospital recognized that case, and
Mm,
then they asked me to take it down. And
that's interesting.
well, I guess just kind of risk management, kind of
Sure.
let's just not social medialize our bad outcomes, even if you can learn from it, which was the whole intent that I was kind of making it for.
Yeah, and not every health outcome is a good outcome either. I mean, it sucks to
No,
say, but it is two sides of a coin. Yes, we want the best, but sometimes we don't get the best. And you were shedding light on the other side. And unfortunately, I don't see any reason why you should have gotten backlash, because I think more people need to talk about that, those real things that patients are also experiencing, the heartaches as well.
I agree with you, but I don't think the lawyers agree with you.
Well, if there's no HIPAA, then there's no lawyer, right? I mean, as long as you follow the rules.
I'll tell you one thing I did learn from that is that social media videos can be part of a deposition.
Interesting.
Yeah.
I did not know
Yeah.
that.
So and the whole thing was if the hospital was able to identify it and employees were able to identify it, then a family member potentially could identify it. And then during a discovery portion, if and none of this went to, legal or anything, but that's the thing to keep in mind is during discovery, the lawyers could request, my social media content about it or whatever.
I see. Okay, yeah. I think everyone in healthcare is afraid of lawyers. I think the average person is afraid of lawyers. So,
when I have a patient and I'm like, "What do you do for a living?" They're like, "Oh, I'm just a lawyer, medical malpractice." It's frightening. You just get white knuckle. I'm like, "Oh."
Has there ever been, like, how about any comments? Has there ever been a triggering a comment that you read and just like, dude, you completely missed the point of this video?
Well, one, this is going to be hard to say and say it without upsetting people. One community on TikTok that is really antagonistic towards my content, and honestly, a lot of other physicians' content, is the chronic pain community. I love them. I serve them. That's, a large group of people that I serve as a patient population. But I, for example, made a joke one time about, it was a dad joke. I said, made a TikTok. The pain scale 1 to 10 doesn't really work for everyone. And so we're going to try and change the pain scale from, 1 to 10 to, instead of that, to megahertz, like, oh, wow, that megahertz. And that was it. It was like an
I should
11.
laugh, but it's a funny dad joke. I see what you're getting at there.
12-second dad joke. And my DMs, the comment section and everything, it was a crusade against me for making a mockery of the chronic pain community.
That community, they're very tight-knit. I mean, I was in the exact same shoes, also yelled at by the pain community because I talked about an experience about how I did not want to fill a prescription from like 2.5 hours away on a handwritten copy for Dilaudid, and so I get it. They get mad, and it's great that they all have each other's back, but it's also really hard being on the healthcare side of things because, especially as a pharmacist, there are laws and rules you have to follow, and sometimes you're painted as the bad guy all because you are following the law, and it sucks. You being an anesthesiologist, I'm sure you have a lot of experience prescribing pain medicine, studying the way more in depth than the average clinician because you're actively prescribing it during, a session of putting someone down under. So, it's tricky. So don't piss off the pain community.
Yeah. And it kind of, they tend to shoot the messenger and sometimes a friendly messenger because an opioid friendly person. I use opioids daily in my practice, just as a disclaimer, not personally, right? Just want to make sure that grammar is correct. And I advocate and teach and I make videos about, just because someone has substance use disorder, just because they have a high opioid use or high tolerance doesn't mean you don't skip the prescription. You don't skip opioids. People still deserve to have their pain treated, but, yeah, it's those are tough videos to make.
Yes. Since then, I learned just to stay away from it with a 10-foot pole. So just stay away, which is a shame because we really should be talking about it because the more you talk about it, the more help ultimately they can get. But what can you do? What can you do? So what's the moment that you realized being a doctor was completely different online than one in real life?
So the moment that I realized being a doctor online is totally different than being a doctor in person might be a little more unique to anesthesiology because most of my patients at work don't talk because they're asleep.
Oh, God. Wow. I bet you have the best bedside manner. I bet they just love when they see you there.
I mean, for many reasons, they actually do. They know I bring the good medications, okay? I bring the happy cocktail when I come to visit. But they online posting all these things, I have learned a greater appreciation and perspective for the patient experience, which is totally different. At the hospital, I don't get time to go to the recovery area and just chat with the patient and say, "How are you? How was that experience?" But I do online. Or let me just say, I don't solicit those opinions, but they're given to me freely and plentiful, and it's been helpful.
For sure. Yeah, that's so interesting. I never really thought about that. I guess as an anesthesiologist, I'm sure you don't get to talk to as many patients as you'd like, but online, they come to you, there's no shortage of people who want to ask doctors questions. So that's great that you are being a resource to them and you are trying to help them from another angle that you might not be able to do in your own practice. So
Yeah.
that's amazing. So Zach, I just want to play a quick video of yours. This is a video of yours from your TikTok. One that got a lot of views and reactions. So I'm just going to share my screen here.
A lot of you are hearing that acetaminophen and Tylenol are bad, but we really don't know why. So let me break it down why it's bad. And we've known this for a really long time. It's just our public health policy in the United States is absolute garbage.
It sounds really good, doesn't it? This guy, he has doctor in his title, and he's talking all these science words, but just be warned, know who you're listening to. It's actually a chiropractor. And essentially, he's explaining an overdose scenario, right? In normal and safe doses, Tylenol, well, it's safe. That's why the doses are recommended by the manufacturer. Tylenol is very effective. I wouldn't have any major fears about taking Tylenol, especially if you're just a normal, healthy adult. And I've already made a video about Tylenol and pregnancy, right? But specifically, just as it relates to the whole autism thing, you can watch my other video on exactly why I don't think there's a connection between Tylenol and autism. And it's not my thoughts or my opinions, it is the research that kind of supports that. But either way, just make sure that you know who you're getting your advice from on TikTok. And at the end of the day, talk to your physician, not your chiropractor, when it comes to making medical decisions that are significant. And he had a child neurologist, someone who trained for many years focusing on one thing, which was the safe development of children, who commented on the video stating, "Hey, you're wrong, and Tylenol doesn't cause any issues." I went back to find that comment and he deleted it.
So Zach, I wanted to point out that video because I liked it for several reasons. Personally, I liked it because number one, there's a lot of misinformation, especially with our current administration, unfortunately, that's pumping out wrong data. And then you have people online, other members of the healthcare team, further perpetuating that data from other angles. So it seems like you had a duty to comment on that, help clear up that misinformation. One thing, and I just got to say this, one thing that really annoyed me about that video, and I don't want to bash on any other healthcare providers because everybody has their part in the team.
Feel free.
I don't understand why he wore the cap. What was the point of the cap? What surgery are you doing? I don't understand. I think that annoyed me the most of the whole video. Like, why are you wearing that cap?
So I one of the negatives to social media, especially TikTok, is that it demands short form. It demands, no more than 90 seconds. Honestly, no more than 30 seconds or people lose attention. If you look at the stats, almost a very small percentage actually watch my entire video, right?
Mm-hmm.
So there's just things you just don't have time to say. But his full credentials, he's actually also a naturopathic doctor. And the reason why I identified him as a chiropractor, because in my opinion, that degree holds way more weight than a naturopathic degree. There are so many naturopathic degrees that you can literally purchase online. Okay.
Really? Like
yeah.
full on doctorate or just like associates, like a certificate?
Oh, yeah. You can pretty much online degree mill and get a doctorate of naturopathy. Now, that doesn't necessarily mean you'll become board certified in it or anything. There is, to become a board certified naturopathic physician, there are exams and stuff you have to take. But regardless, you could do these. You can do these online things and get that, and you could tout that as your credential. Maybe yeah, it is. Maybe he went to an in-person one. I don't know, but personally, I would respect a doctor of chiropractor more than I would actually respect a naturopathic doctor, an ND.
Yeah,
But
I don't know much about the ND route, but I know that at least with chiropractor, there is a big like accrediting board, and it does seem a little bit more legit. And I'll say that my sister is in chiropractor school, and so just kind of hearing about what she
oh,
kind of goes through, I'm like, okay, that seems more legit. And I gotta say, love my sister, she's great. And even her, she sometimes is just like, yeah, I don't know. They talked about this thing, then they talked about the p values, and I just don't get why they want to do it when they're, and I'm just like, good for you for thinking for yourself and looking at the data. Like, thank God. We need more chiropractors like you.
absolutely. So your sister's in chiropractor school. Okay. I'm going to have to go ahead and get out the interview now.
It's okay. You can say whatever. Hey, this
No, I'm
is,
kidding. I'm kidding.
you can say what you want, man. This is your opportunity to say whatever's on your mind.
So going back to the scrub cap thing though, is for one, he was wearing it for clout. No doubt. No doubt. He was wearing a costume for his video for credibility. But two, if he wears a scrub cap in his practice, depending on actually in New Mexico, chiropractors can do crazy things like prescribe medications and stuff. But if
Oh,
he's a
wow.
naturopathic doctor and is board certified and licensed to practice as such in his state, was likely doing some sort of injections or something. I'm
Oh,
guessing.
wow.
I don't know. Yeah.
I did not know that. Yeah, I know it's state specific, but that's wild.
Well, I didn't even get into all this. Like, I haven't even gotten into this stuff on my platform, but like stem cell injections and all these things, there's so many expensive types of injections that there's zero data to show that it helps. There is data to
Mm.
show that it can harm, obviously, infection, bleeding, etc., damage to surrounding structures, and it's expensive. So, anyway,
Yeah, it does no good if your patient can't afford it. What's the whole point of it, right? It
yeah,
just reminds me of a video I saw from another physician who was openly venting because a naturopathic doctor, I guess, has the ability to write for all these laboratories
yeah,
stuff, but they're not trained to really assess the lab and interpret the data accurately. And this physician specifically did arthritis. Whew, that one's a hard one to say. Sorry, rheumatoid arthritis. And I guess one of her patients came back with all these labs, and the shit, patient's like, "Oh my God, everything's abnormal. What do I do? This naturopathic doctor prescribed this stuff." And as a clinician, you're sitting there just like, why the hell did you do all this? Now I have to explain to the patient that all these labs are useless, but now they're fixated on all these,
yep.
everything being abnormal, and it's all it did was cause panic and stress. So yeah,
That's the
I don't
story
get
of a
how
D
they get.
dimer.
What's that?
That's the story of a D dimer.
Mm.
Every time you order it and it's high, now you're like, man, what do I do with it?
Damn. Well, I think this segues into a good question, because this is what triggers me talking about all that. But what's something that you see online all the time that triggers you? Questionable scope of practice, common advice, trend.
Something that I see online that really triggers me is when a chiropractor does a high velocity adjustment on a child,
Mm.
or when someone who's desperate for answers for something that's going on in their life that I don't have the answer for, and those people are taken advantage of. Something that I was so angry about this morning. I'd never heard of it. It's called EBOO, EBOO. Have you heard of this?
No, I've never heard of that.
It's like the concierge version of ECMO, right? The fashionable ECMO. People are going to these wellness spas and paying $1,500 a session for extracorporeal blood oxygenation and ozonation or something. Okay, double check what that stands for, but it's mini ECMO. They're taking deoxygenated blood out of your vein. They're running it through a filtration system. They're oxygenating it, and they're doing an ozonation process to it, and then they're putting it back into your vein. So they're delivering oxygenated blood back to your. So it's like VV ECMO.
What the heck? ECMO is like intense too. Like I only learned about it because my wife works in the ICU, and she was telling me about the ECMO. If we can explain a little bit for our listeners, because I don't know if the average pharmacist knows what an ECMO is. I only know because my wife told me. But basically, their blood is being pumped around by a machine. So your blood is leaving your body, going through a machine, and being circulated back into you. And so you pull out the wrong hose and all of a sudden half their blood's coming out. So very, very dangerous stuff. Very dangerous stuff.
Yeah.
And that is insane to me that a wellness ball is doing something along those lines. How is that legal? I don't understand.
I mean, in order to do this, they're having to heparinize someone's blood. I mean, and it's so funny because most of these spas target like, oh, we're all about wellness and holistic and natural, and we want your body to heal itself. And then, but if you spend $1,500, we'll heparinize your blood and put you on a mini version of cardiopulmonary bypass. And it's legal. It depends on the state, but especially if they have a naturopathic doctor, right, working there, and sometimes physicians, MDs or DOs will own these as well, or be the medical
Interesting.
director. Yeah.
Wow. Okay. That's a twist I would have never seen, but I don't know. I don't know. I guess there's a lot of twists I've been seeing lately, like CDC saying that vaccines cause autism all of a sudden. But what a dumb time to
Just
be
as a
alive.
disclaimer, vaccines have not been demonstrated to cause autism, and
Right.
Frank, it's been the inverse.
Yes. Dr. Andrew Wakefield was, or should I say former, was the first clinician who falsified the paper and published it in the Lancet, saying there was a link between vaccines and autism, all because he was hired by a law firm to try to find this link. This paper was later redacted after they realized what the F are you talking about, but the damage was already done. So you can thank that asshole for starting the fire, I guess.
And go read the redacted paper yourself. And the
Yeah.
comments to the journal about its redaction.
Yeah. Very, very crazy stuff. All right, Zach, last question for you. What's one thing you've learned about people from your comment section that you wish more clinicians understood?
I think the biggest thing that I've learned from doing social media and from my comments is that we as physicians and even nurse practitioners, if you're working in a clinical setting, even you, Robbie, we need to have patience for our patients and realize they may have just gotten the worst news of their life. And again, this is another scenario where it's an everyday thing for me. This is normal. But some people may only have surgery one time in their life, right? We need to respect that. Even if we don't have the time to give, we need to find a way to give it.
Definitely. Yeah, I mean, I work in a psychiatric hospital, and if you want to be good at your job, you have to be patient because you ask someone a question, they go on a tangent, and you have to be able to bring them back to be a little, be direct, but also not be too intense about it because then you can trigger them, go the wrong way. So definitely agree with that, especially in the psychiatric setting. And I've seen some of my coworkers, like they'll definitely lose their patience because, like you said, it's like an average day of them seeing this. And sometimes I think like, oh, I think we just need to slow down and let this person simply be heard, vent about what's going on. And then once they are able to vent, then a lot of times they're okay. And then they're more agreeable to take their meds. So patience is definitely a virtue. Yeah. How have you demonstrated that online? Giving people patience.
I think the best way of me demonstrating giving people patience online is by taking the time, which my wife hates, to respond to a large portion of my comments and DMs.
Wow.
I really need to stop doing that, honestly. I don't have the time.
How do you balance your personal life with all your social media? That just seems like a very big daunting task, especially with the amount of followers you have.
I don't balance. It's not balanced. It's ups, it's downs. My wife would say I don't balance it and that I need to focus a little more on my family, and I think that's true. Somehow it's working. I wish I could answer that question. I don't have an answer for you, Robbie. I'm still trying to
Man,
figure that out.
you need to start a student rotation as a social media manager and in your set. Someone who speaks
Perfect.
the jargon and language. Boom. Give them an A. So any students out there listening, Dr. Zack is
Please.
looking for a student to help him with the social media
It'll be
training.
volunteer hours.
He'll write you the best letter of recommendation, not ChatGPT.
Tremendously written.
It'll be handwritten on a piece of paper to demonstrate it was not done by ChatGPT.
Absolutely. I'll use calligraphy.
There you go. You use a little quill and ink.
Yeah, I will write your letter of recommendation with a quill.
Well, Zach, hey, thank you so much for joining me today. It's been a pleasure. Huge fan of your work. Please keep doing what you're doing. Zach, we do like to give everybody your social DMs so they can follow you on Instagram, Twitter, all that stuff.
If you search Dr. Zack MD on any of the platforms, you should be able to find me on YouTube. I am the White Coat Couple. Me and my wife post both of our social media contents on the same channel.
Awesome. Well, listeners, thank you so much for tuning in. It's Zach. It's been a pleasure having you. We'll see you guys next week. Have a fantastic day.
Hey,
Bye.
thanks, and happy Thanksgiving.
Happy Thanksgiving.
Rated RX, you do